I have learned many things from this course. However, there are certain topics that have really stood out to me. The first topic is physician-assisted suicide. I spent the most time learning about this topic because this is a topic I was assigned for my group project. While learning about physician-assisted suicide, I had to be able to differentiate this between euthanasia. Euthanasia is the painless putting to death of a person suffering from an incurable condition. There are two types of euthanasia: passive euthanasia and active euthanasia. Passive is the withholding of treatment that would otherwise prolong life, allowing death to occur naturally. Active euthanasia is when someone takes an active step to deliberately end another's life, such as an overdose of medication. Assisted suicide is the procedure in which a physician helps a seriously ill individual to comfortably end his or her life, generally by prescribing a lethal dose of a drug. Assisted suicide is actually legal in the states of Oregon, Washington, Vermont, and Montana, and also in the Netherlands and Switzerland. There is a false belief that too many people will use this technique. However, in the Netherlands, only 2.7% of the population uses assisted suicide each year. There are actually fewer assisted suicide deaths than prescriptions written, so that means that some people actually decide not to go through with the procedure. When talking about physician-assisted suicide, it is important to take into consideration an individual's autonomy. This includes the right to decide for themselves, the right to die when they want, the right to open communication about their death, the right to a painless death, and the right to fully explain treatments and refusal of treatments. It is also important to respect a person's quality of life. Studies show that 69% of terminally ill patients support assisted suicide, and there is no association between a person's illness and symptoms and them supporting assisted suicide. Another topic that I really enjoyed learning about was Alzheimer's disease. We learned about the disease itself and also an environment that is important for people with Alzheimer's disease to live in. There are currently more than 5 million people affected by Alzheimer's. It is said to be the most expensive condition in the United States, with treatments and the research being done on this disease. There is a common misunderstanding between dementia and Alzheimer's. Alzheimer's is a form of dementia, and it's the most common form of dementia in the United States. Main indicators of this disease include memory loss and confusion. When designing a place for a person with Alzheimer's to live in, it is important that the place reminds the resident of their own home. The bedrooms shouldn't be too small, but also not too spacious. They should have personalized spaces, filled with photos and decorative items. Buildings should be well lit, with lots of color contrast to avoid confusion. While it is important that residents have their own personal space, it is also important that they have social areas to keep residents stimulated, active, and engaged. We briefly discussed the topic of patient morals and beliefs. This is an important subject, especially in healthcare, because some cultures or religions believe in certain ways of healing, and this may limit a patient to what treatments they can use. Another subject we covered was nursing homes and assisted living facilities. Patients in a nursing home require more intense care than those in an assisted living facility. The average cost to live in a private nursing home is around $84,000 a year, and to live in assisted living is over $40,000 a year. Services provided in these facilities are assistance with activities of daily living, medication distribution, prepared meals, and also in a nursing home, patients may receive physical therapy, occupational therapy, and speech therapy. Assessments of potential residents are done before they can be admitted. These assessments are to determine individuals' needs to ensure that they are being placed in the proper type of facility. There are two types of assisted living facilities: a community-based residential facility and a residential care apartment complex. A typical CBRF has staff on site 24/7. Staff assists residents with activities of daily living. Most CBRF buildings have safety features such as door alarms to prevent residents from wandering outside the building. Some facilities have buildings specially designed for memory care. These memory care buildings specialize in residents with dementia and Alzheimer's. RCAC facilities are for residents who are more independent but may be at risk of falling, have some limitations, or just take comfort in knowing that staff is there to assist if needed. We learned the importance of medication management in the elderly. Older adults may experience enhanced drug effects due to the decline in renal function and blood flow, which decreases drug excretion, and the decline in liver metabolism and blood flow, which decrease the breakdown and clearance of drugs. Types of drug-drug interactions are where one drug changes the absorption, metabolism, or excretion of another drug, where one drug interacts with the mechanism of another drug, or where side effects of one drug exacerbate the disease, so more of the second drug is needed. Nutrition is important for people of all ages. We talked about My Pyramid, which is the daily recommendations of the nutrients you should be taking in with each meal. We also learned about vegetarianism and veganism. Vegetarians do not eat meat. Vegans have a more strict diet than vegetarians, where they cannot consume any animal products. We also learned about fad diets such as Weight Watchers, Atkins, and South Beach diet. These are not ideal for elderly and nursing homes because the residents typically do not cook their own meals. One of the most critical things I will take away from this course is the importance of group work. The key to success for just about any group is communication. Group members should be organized and plan ahead to stay on track. These are important for students to remember in their continuing education and future careers. Because of this course, I have a better idea of the types of patients I may be working with and the types of facilities I could work in. I also have a better understanding of how each individual's morals and beliefs may differ, and as a healthcare professional, I must be aware and accepting of those lifestyles when providing care for my patients. I have learned so much from this class, and I believe that it will benefit me greatly as a future healthcare provider. Thank you.